Please feel free to share them with the hashtag MMHC19 2019, and follow us on Instagram at MuslimMHealth_. And yeah, we're also on Facebook. So with that, we're gonna start this workshop. So up here I have, Dahir Nasser, who is leading the California Community Reinvestment Program that is funding mental health and substance use treatment, and working with communities who have been impacted by previous drug policies. He has a master's in public health and a bachelor's in psychology. He's accompanied by Dr. Nadir, who is the president and co-founder of the Muslim Social Services Association. So if you guys have questions, we'll be doing them kind of throughout. So yeah, just kind of raise your hand, I guess. We're doing it old school style.
It's after lunch, and I know that everybody's feeling the kind of food in their belly. So I just want to make sure that we all give each other the energy. And I want to ask, is this room too dim? Do we want more light?
Yeah.
Yeah. I was thinking so, but I didn't want to make an executive decision without asking the room.
That's a good decision. They can be distraction too.
Assalamu alaikum.
Alaikum assalam.
It is my pleasure to be here. I want to thank Dr. Firdausi, Mary, and the Muslim Mental Health Conference and Institute of Muslim Mental Health for the opportunity to be with you today. We are so excited to have this opportunity to be with you. So this presentation is brought to you by the Islamic Social Services Association USA. And my co-presenters are Dahir Nasser, as you heard introduced, but I also want you to know this presentation is also by Dr. Cheryl El-Amin. Yes, Dr. Cheryl is very sick, so I ask that you make dua and pray for her. And we love her and we miss her very much. So I just want to make sure that you know that. So I want to tell you a little bit about the Islamic Social Services Association, since we have a little time to do that, and I didn't do that earlier. The Islamic Social Services Association, as we mentioned, is 20 years old this year. Alhamdulillah. Wow. Alhamdulillah. ISA is a education and advocacy organization. So we're not a direct service provider, but what we've done over the years is advocated for the need for social services and mental health services and family services in the Muslim community, as well as the need for our colleagues of other faiths to develop cultural sensitivity and to develop programs that have cultural sensitivity with regard to various populations, and then also the Muslim community. You know ISA is at work when you go to, let's say, for instance, a hospital, and you are in labor delivery, and you don't have to explain that if you're a hijabi, why you need to wear a hijab. Right. You know that ISA is at work when you go to a public school, and or when you're a child in a public school, or you are a parent and you go to public school, and they understand that maybe as even a 13-year-old that maybe you practice Ramadan, or you need a space for prayer after Dhuhr, that's how you know ISA is at work. You know ISA is at work when practitioners in the field, marriage and family health, marriage and family therapists, counselors, and social workers of other traditions are liaisoning with and speaking with the Muslims in the field trying to find out, how do we work? We've got a Muslim patient. What do we need to do? What are some of the resources? How can we help? That's how you know ISA is at work, okay? And that's how you know ISA has been at work all of these years. You know ISA is at work because the Institute of Mental Health is here, and we advocated for this kind of thing 20 years ago. You know ISA is at work because, we've been working with peaceful families all these years and had the opportunity to engage in domestic violence prevention and education, and we partnered over the years. These are the ways that and ISA is at work in Arizona because we have the Arizona Muslims for Human Services, and we network together to help. So when there's someone who has a mental health issue, a family issue, we need counseling services, we're networking together so that we can find services for one another. That's how you know ISA is at work. And so just to give you some idea, because when you're not engaged in the direct service provision, most oftentimes people think, well, how many people have you seen in a counseling setting? How many intakes have you done? We're not that organization. We're the organization that has supported that and continues to support that over the years. And we have been here over these years, and now we're working to promote a cadre of young people. I'm ready to pass on the baton. A cadre of young people, and that's what we see. We've taken a road trip to the Muslim Mental Health Conference, and that basically was young people who were interested in the field, new professionals, students who wanted to learn about mental health. And so we gathered them up and we called it the college road trip. It was the college road trip. We also had interns, and one of our interns is here today, but we've had other interns that have worked with us in terms of education and advocacy over the years. And it seems like there's one other thing that, so for those of you who attend the gala tomorrow, you'll also get a commemorative program, and it'll have the 15-point plan that we've been working on. Two other things that I want to share with you. We have promoted the campaign over the years for National Muslim Marriage Week. So if you've heard about National Muslim Marriage Week, that's how you know ISA is at work. Because we've had a campaign, and we've been working on this campaign for maybe the last 8 years to promote healthy marriage, premarital counseling, and throughout the country as much as we can, and we've been working together to promote healthy marriage. And the other thing is the Children of Adam project. We've been working together to promote that is amongst the Muslims, intra-community understanding with regarding our diversity. So we've held different programs around getting to know each other, because Allah says we should get to know one another, right? And we don't. And we know that we have racial issues within our community. And so we've been working together to promote an understanding of one another, because you can reach out there and you can say, those people out there, they don't know us, they don't like, but we don't know each other, and we can't support and empathize with each other until we know each other. And so that's what the Children of Adam project has been about. We focused on the African American community and getting to know our history as Muslims in America. And then last year we also had a program on Children of Adam focused on the Latino community. And so we're moving, and we have been moving in the direction of helping us to get to know each other. So like Zainab, you're here, to get to know one another. So I wanted to share that with you so that you would, because I know a lot of people say, I haven't heard about ISA, I don't know who ISA is. And ISA's been around 20 years and I don't even know who it is. Well, sorry. We have a network of Muslims in this field throughout the country, and we enjoy that and we want to continue that effort. So thank you. So our objectives for this is more of a workshop, more of a practical workshop, and it's for you. It's for us, okay? Because who helps the helper, right? We are so busy working together for whatever our reasons were. We decided on these fields, most of it is because we had some passion and some compassion, and some things may have even happened in our lives, and we don't want that to happen to anybody else. And so we got involved in this field. But oftentimes we don't take care of ourselves. And so that's what this workshop is. I know there was a workshop on self-care earlier for parents. This one is for you. This is for you, the helper, you, the counselor, the social worker, the psychologist, the activist, wherever you are and wherever you fit in, this one is for you. So we want to engage in self-care assessment and goal priority setting using a holistic framework: professional, spiritual, physical, personal, and emotional. And we want to kind of define self-care. What is it? We want to identify, what are your personal needs, because self-care is unique to each and every one of us. How we operationalize self-care is going to be different depending upon, who you are, where you are, what you got going on, what your family and personal issues are. And we want to spend some time, and that's why we have so much time, to develop your own personalized self-care plan. If you don't already have one, and if you have one, inshallah, you're going to make it better. Improve it today. Okay. And so why this focus? Basically, I ask the question, who helps the helper? And I ask this often and over again, and too many times I've seen us struggling with stuff. And I bet that there is at least 1/3, maybe a half of us who are going through stuff, or who have gone through stuff to get here, or who've gone through stuff before we got here, and we still have anxiety, we've got some issues, maybe it's resolved, maybe it's not resolved. And so I think that that's really important. And we have diverse circumstances. Dahir's going to talk a little bit about that, and differing ways of engaging. And currently, our reality is taking a toll on us, okay? Or can take a toll on us if we're not mindful of it. And we don't want to lose anybody. We ain't leaving no social service, human service, mental health provider behind. We ain't leaving nobody behind, inshallah. And it's real. You
can lay it out, Mom.
Yeah. The reality is, I got a call from somebody who's suffering right now, okay? There's a lot of us that are suffering, and I'm trying to share this with, and also keep their confidentiality and their anonymity. And part of the reason is that because of the stigma that we have in our society, we have it in our own community, and it's so hard for us to share what we're going through. But we have to. We've got to find a way to do that, and we've got to be more sensitive to that. And we have a professional, personal, and spiritual responsibility to take care of ourselves. Professionally, as social workers, part of the curriculum that we have, I'm a field liaison, so I mentor students who are doing their internships, and it's the last item on the learning contract. It says, what is your self-care plan, or your learning contract is to develop your self-care plan. Why? Why do you suppose that's important? Don't all speak at once. Why? Yes, ma'am. So you don't bust, so you don't burn out, right? What's the point of spending all these dollars on a college education, and we're investing in you, and you're investing in your education, and we're investing so that we can help others, and then we're no good. We're no good to anybody. We're no good to ourselves, and we're no good to anyone. And so, the task we have is to put our own masks on first. And I am one of the worst for that. And so this is for me as much as it is for you. So that personal responsibility. We have a spiritual responsibility as well. Because Allah told us that our body has rights over us. Right? On the day of judgment, we're going to be asked about that. What did you do? How did you did you overrun yourself to the point of, and I told you, eat 1/3, sleep, rest, pray. We have responsibility over ourselves, but are we taking care of ourselves? So this is part of our responsibility. So our body has rights over us. And what is self-care really?
You made it hard to follow, you guys. Before I jump in, just real quick, I'm going to say that I really appreciate academic spaces that still feel like a conversation, and this small, kind of intimate setting, I think, really helps to make this conversation be one that is interactive. So if folks have comments as we're going through, feel free to sort of share, and we can have that space. We have 2 hours or so, so I think we can make that happen. Is that okay? Self-care, what is it really? The first thing, self-care is a verb, right? Self-care is a practice. Self-care is an action. It's not something that we talk about and then we leave on the shelf. I will just share about 2 years ago, I was working in public health at the state health department, doing activism, advocacy type work, policy work, and I had gotten so caught up in doing the work that I ended up in the emergency room because I had overran myself. There was a shooting in the local area, Stephon Clark, some of you may have heard about him, up in Sacramento. I had just started a new job. I was trying to help all the young boys in the neighborhood who were potentially facing that same fate. I was volunteering with the NAACP. I would start my days doing activism, then go to work and do public service, and then come out of it and try to mentor and do tutoring and all of these things. And there just literally was no room for me. I was about 45 pounds bigger than I am now. And it was critical for me to understand self-care, right? That in order for me to continue and to actually make the kind of impact that I wanted, which was sustainable, that was going to be something that I would be able to actually look back on and appreciate, I needed to be able to sustain myself and to sustain. I think it's also important for us to sort of internalize the fact that we can't just talk about it. We have to walk that walk, and it requires us to make a decision, and each and every day to sort of step into that decision and say, yes, I'm going to continue to prioritize my self-care. So the definition is the practice of taking action to preserve or improve one's own health. And I think preserve is so critical, right? Because Allah subhanahu wa ta'ala provides us a certain level of health for most of us, right? And so the disease is what sort of shakes up that sort of normal state. So it's important for us to understand that that gift that Allah subhanahu wa ta'ala provides us, we should be able to preserve it as best as we can. The practice of taking an active role in protecting one's own health, one's own well-being and happiness, in particular during periods of stress. Stress is just kind of a part of the job, right? It's par for the course. We are trying to understand other people's stress. We're trying to get up under that stress and understand sort of their trauma, what things they're going with and how that's impacting them. And so oftentimes that stress sort of falls back on us. And so we have to figure out how to walk that balance of understanding their stress, understanding how that makes us feel, and being able to sort of work to address that. And then lastly, self-care may be the antidote to burnout. And as my esteemed colleague and mother mentioned, burnout is not the goal. We are not trying to run this race to fall before the finish line, right? And so in order for us to really accomplish our goals, especially, I'm a public health practitioner, so my goals are not on a one-to-one basis. It's like, how do we keep the population healthy? If we have 1 million Muslims, how do we make sure that 1 million people are healthy, right? And so in order to do that, that requires a certain level of kind of stepping back and understanding sort of where we're at and where we need to go. And that may mean that this fight today is not the fight that I die on, right? I have to sort of disengage potentially to be able to sort of sustain that activity for the long term. Any questions or thoughts at this point? Yes, sir.
I have to say that professionally, that this issue of burnout has entered so much of our. As a son, contribute that professionally, this issue of burnout has come into so much of the discourse in our professional societies, whether it's medicine, the APA societies, the public health societies, that I personally leverage that for my own self-care with my boss. And so that issue of burnout is not trivial. It's not just something that, soft skill or lovey-dovey kind of stuff. It's something that you should really, when you have needs at work, allude to this and leverage that to create space, whether it's funding to travel or time or whatever it is. this is an important time because it's being discussed in every professional society. Healthcare professional, I mean.
Absolutely, thank you.
Can I add to that really quick? Oh yeah, that was you. Thanks. What's your name, buddy?
Dahir.
Dahir. Thank you. So I appreciate what you just said, Dr. Hamada. Hamada, sorry. Actually, what happened was when this New Zealand shooting affected me really badly, and interestingly enough, my advisor is like a really famous expert in trauma, and but I'm an academic. I'm also in public health, and what was so difficult about this was, you're from an academic setting, so you have your academic hat on, but then you're a person too, and you're a Muslim, and you're a human being, and you have needs, And when the shooting happened, it affected me so much, and my advisor was expecting me to submit this grant for my research, which the due date was April 8th for NIMH. And I was already in such a fluster, and this event happened, and everything just ended, And so I emailed her and I said, this is a very difficult time for my community. I'm going to grieve. And she said, I actually don't expect you to work for the day. But then I thought, why only one day? It's gonna take a lot longer than one day. Thankfully, it was my spring break, so I guess there were less expectations of me. But what was interesting was my other two advisors didn't reach out to me, didn't say anything. And I think this is the culture of academia. It's extremely toxic to self-care, especially when you're expected to produce manuscripts, apply to grants, go to conferences, and have a family and everything else, right?
And together.
Huh?
And hold it together.
Hold it together. Hold it together. Being a woman of color in this space is so difficult. Muslim woman of color. And so basically the point of this story is that I wanted to share that I felt that academia didn't humanize me. And academia and many professional spaces of ours expect us to be able to move forward without the recognition that we also need this self-care period. And it is a very basic human need. So I just wanted to share that. I don't know if anyone else went through something similar.
Thank you for sharing. And I did, and I actually do often. I was pulling into the parking lot Tuesday, because I had Monday off, and there was a famous person in LA who's a businessman, musician, who was killed. I literally was in tears as I was pulling up to work. And I'm lucky enough to lead a team. So I told everybody this is probably not gonna be my best day. The staff meeting that we had, we were able to kind of talk about things, and I try to set a culture where whenever people are dealing with all of the different things that we deal with, you should be able to say that. When I ask you how are you doing, it's not an expectation that you say I'm good, because I don't believe you, because that's not a real human response, right? I'm good, good with what? What are you good with, right? So I think that being able to honor our humanity is critical. And I'll also just add real quick that I think this idea that you're bringing up of intersectionality is also critical, right? That we have multiple identities that we bring. I'm part African American, I'm part Somali, which some people may think is the same thing. It's not. When a bombing happens in Mogadishu, somebody who's African American may or may not take notice of that, but I do. Right? When Nipsey is killed, someone who's Somali may or may not take notice of that, but I do. When Gaza is being bombed, I'm Muslim, I take notice of that. When Ilhan is being, bombasted in the assembly, I take notice of that, right? So now I have maybe 4 or 5 layers of crap that I'm coming in with, right? And people are like, yo, what's up? Why your face like that? And I'm like, oh, and you didn't hear that the DA in Sacramento just acquitted the police officers who shot Stephon Clark, who's 5 minutes away from where I live, and he has 2 daughters just like me, and so I appreciate what you're saying, and I think that we have to be okay with saying all of those things to people and not feeling bad about it. Because I've gotten to the point now where I don't expect someone to understand me just on the face. However, if you're gonna ask me the question, then best believe I'm gonna tell you the whole answer. Don't ask me how I'm doing and expect that I'm good. I'm gonna tell you how I'm doing. You can decide how you receive that. But I'm not gonna give you the standard because I think it doesn't do justice to the actual conversation that has to be had.
That's right.
I'm gonna go to the young lady behind you and I'm gonna come here.
And it limits our work on addressing stigma. How can we normalize things if we don't talk about it?
I kind of wanted to add to everything that everyone has said so far and also bring up vicarious trauma. And I think, I don't know if I'm jumping the gun and that's something that you're going to get to. But
talk a little bit about it.
Okay, great. So I actually, when I was doing my internship, I was in working at a community health center back home in Massachusetts. And this was when Trump had just gotten elected. And I was working with refugees coming from Iraq, coming from Afghanistan, coming from anywhere, everywhere, Guatemala, doing a lot of work with undocumented individuals as well. And for me, I didn't realize, but I kept breaking and shutting down, getting tired of sitting with my my patients at that time, saying, I don't know if you're going to be safe if I let you out of this door because I have no idea ISIS next door right now. And it was getting hard, and I was lucky enough to have supervisors that were aware of what was happening because I didn't understand what was happening to me. And until it was too late, kind of thing. And until I was like, I'm out for the next couple of weeks because I need to recover. And so I'm grateful for that experience. I'm grateful for my supervisors, and I'm more mindful of who I am now. So when Christchurch happened, and I kept seeing, I'm working, doing my postdoc at a counseling center in California, actually in Davis. And when I kept seeing Muslim students in the waiting room, I realized I can't do this today. And so I got the space and I spoke up and was able to go home, but it was hard. And I felt bad. I'm like, I'm a trainee, I'm supposed to show up, I'm supposed to do my work, I'm supposed to work to the ground, like this is what I'm supposed to do. How can I turn around and say no? But I couldn't. And so I think there has to be more conversations around saying it's okay to do that, and giving space and understanding vicarious trauma is something that we need help around too.
Absolutely, thank you.
We'll go maybe one more and then we'll keep rolling with that.
Yeah, so I'm in the academic world now doing student counseling, but I had more the issues that you talked about, the activist burnout. I've been a Palestine activist for a long time. I'm part of the Muslim Anti-Racism Collaborative, that maybe some of you have heard of. And I do a lot of work against the Countering Violent Extremism program. And one of the main things that we haven't talked about that I've always gone to is psychotherapy. So, you know, when I'm in that kind of situation and feeling burned out and those kind of things, going to a very good psychotherapist is very helpful. And as we all know, it affects the work we do with our clients and that type of thing anyway.
Thank you. Sister Nadir.
Assalamu alaikum. My concern today is not so much about myself, even though it is about myself as well. But I have a friend back home who is
Where's back home?
Oh, Maryland. Who is caring for her husband who has Alzheimer's. He has dementia, and I mean, I think he's considered to be in the beginning stages. But I've had several conversations with her in reference to, you know, taking care of him and dealing with the issues, and I can see how stressful it is for her, and I'm always so worried about her and trying to encourage her to do things for herself, to try to get away, but there's some other complications, but anyway, but I'm just glad that you all are doing this, because I'm hoping that I can say, I know I've read the program, but I guess I didn't really pay attention to it, but once you started talking about self-care, she's the first person that came to mind for me, so I'm hoping I can take some information back and share with her, try to, because he's in a situation where she just can't always leave him alone, especially for long periods of time. So, and then right now they have a family member who has 4th-stage cancer, and so that's another big issue. So I just want to, maybe to take something back to her to help her to find a way to self-care, because she's confided to me about, how his illness has affected their relationship. I don't know how many people know some of the details about how Alzheimer's work and how a person really changes so much, their behavior, their attitudes, and so many things changes. And sometimes she's questioning herself, is he really doing this, or is it really the illness? So I mean, she's torn between, is my husband really, because sometimes he gets really mean, I said, when I say to her, well, was he like that before he got sick? Was he treating you this way before he got sick? She said, well, no, not really. So she has to fight with, with accepting that that's this illness, it's not him, but I can tell she's stressed. And so anyway, thank you, and inshallah, hopefully I can take some stuff back to her. So that's a little bit different from, I guess, some of the other mental health stuff, but it's still mental health.
Thank you all for sharing and contributing to the conversation. One more, and then we'll keep on with the slide deck.
I think everyone who's just shared has really great points, and I also want to point out that we're here and we're in this space, and we have this opportunity to actually come and talk about self-care. And I've been thinking a lot about that because of the work I do. But after Christchurch, I was obviously, when you think about vicarious trauma,
So I think we can all say, once upon a time, nobody talked about this stuff. You were expected to go do your job, don't complain about it, don't bring your problems to work. Because we ain't paying you to deal with your problems. We're paying you to deal with our people, our clients, right? But now we're getting to a better place. We ain't there totally yet, but we're getting to a better place. And as Dr. Hamada said, we have literature, we have something to stand on. When the need arises, for us to be able to address our own needs. And not to move forward, because actually we could be a detriment to others if we don't take care of ourselves, right? Not only to ourselves, but to others. And one of the things I didn't mention, I mentioned we got to take care of ourselves. Our body has rights over us, but our families have rights over us too. Okay, and this is for the activists and those who are workaholics, okay? Our families have rights over us too, okay? They need our time. We have to schedule our time so that we always schedule in time for family, time for our spouse, and time for ourselves. So it's a big job, and I'm not suggesting that this is an easy task, but I think the more aware we are of this, the better at it we can become, and the more we practice it. It's like, practicing Taekwondo or something, the more we practice at it, the better we get. And the less we practice at it, the more difficult it's gonna be, so I think that that's important. So the literature is growing, I haven't done a full search on this yet, and I know some of you researchers in here, there may be some of you who have, but if you haven't, this is an important topic, so I would encourage you to maybe take this on. But just a couple of pieces that you might look at. There's a new textbook, Burnout and Self-Care in Social Work. And so Sarah K. Smullins. So that's one piece there, and there's another piece on social work. And actually there was a few pieces. Like I said, the Council on Social Work Education has included this in the curriculum. This is something we have to do. You can't graduate without a self-care plan nowadays, so that's important. And then I snuck in some personal development stuff in there, because I think that's important. And this is actually a really good book, High Performance Habits by Brendan Burchard. And then he has a whole chapter on generating energy. And basically what he's saying is if we take care of ourselves, we can be more successful and more effective in the work that we do. And I really have gotten a lot of this. So that's my own, that's something that I'm utilizing, my own tools. So I thought I'd share that with others. Yes, Dr. Hamada.
Are we going to share the slides?
You all have the slides, I think we're sharing. So the question was, are we going to share the slides? So yes, we can share the slides.
Thank you.
So, common ailments. Okay. We talked about burnout, compassion fatigue, secondary traumatic stress, stress-related illnesses. These are some of the health concerns, the mental health, and the physical health. Because when we are impacted with some of these issues, they are also reflected in physically how we feel. You know, so some of us have, I don't know why this is making this noise, but irritable bowel syndrome. I mean, all kinds of different issues that affect us mentally and physically. I know that last week I was working on the conference and the gala, and my chest was, I had such anxiety. And so certainly one of the tips and things important is to pay attention to yourself. Pay attention to your own health. And we'll talk about that a little bit more, but I was just pounding my chest like, you saw me, right? I was like, oh my God, it was because of the anxiety. And I'm excited you're here, but it was a little bit stressful getting here.
I just want to put a finer point on number 2, compassion fatigue, because I think it's hard to even know that that's what's happening. But sometimes you can get to a point, and I know that I've been there, where it's just like, I've given everything I got. And so that next person who has a legitimate right to my time, my attention, my focus, my empathy, is not going to get it. Right. And sometimes that can come off a whole lot of different ways, right? You're not engaged, you have lost interest, a whole host of sort of assumptions that people make about why that is, right? But that, I think, has to be spoken about because it can be invisible. We can be treating people a certain kind of way, and they don't know why we're treating them that way. And it's literally, we're just spent. I've given it all, I'm empty, and I have to figure out how to refill my cup before I can give anything else to anyone. And so I think, particularly for the people that we love the most, it's critical for them to know that that's how we're feeling, so that they don't perceive that in a way that is wrong, right? That it's not that we don't love them, it's not that we don't care, it's just, man, I gotta figure out how to fill myself back up.
That's so important. So some obstacles to implementing a self-care plan have to do with some of the messages that we were raised with, right? One message is, you should be self-sacrificing, oh, don't worry about you. Your job is to take care of everybody else but you. So we've been raised with certain messages, especially, I'm going to say right now, especially as women, not only women, but especially as women, many of us have been raised with this notion of self-sacrifice, that we should be self-sacrificing, and that we can't take care of ourselves because we got to take care of everybody else, the kids, the husband, the parents, the community, the this and the that, and there's never any room left for us. And so depending upon the messages that we've been raised with, it may be difficult for us to implement a self-care plan, to take care of ourselves. Poor health habits. If we've developed, so I'm a prevention specialist, I'm a social worker, but I'm a prevention specialist. And so it's so important for us to remember the importance of preventive healthcare and preventive mental health. So all the things that we know that we need to do that we don't do, the nutrition and the diet and the exercise and all of those kinds of things, we've developed poor health habits. I'm gonna go back to myself this week. All the things I knew I should do, every day I got up, I put my workout clothes on because I have a treadmill at home. So I didn't even have to go anywhere. I don't have to put a hijab on to go nowhere. And I got that on purpose. Do you think I did that? I sat at that computer because I had tons of things to do, tons of people to call, and never got on the treadmill. That's a poor health habit. And in the midst of time, I'm still eating stuff that's not good for me. So I'm going to be transparent. Am I the only one in here that does stuff like this? Okay. All right, because I got a couple of buddies out here. We got to work on that. Another issue is the lack of health coverage. Okay? So let's be real. Lots have been done in terms of the Affordable Health Care Act and trying to get health care for everyone. The reality is today that still people don't have health care. If you're a solo practitioner, if you're self-employed, if you don't work for a company that provides it, if you're maybe a student and you fell off your parents' health care coverage, or if there's a lot of different reasons, a lot of people. If you're an imam that works for a masjid that doesn't pay you much and doesn't have health care, you don't have health care coverage. All right? That's a problem. We have had our imams and our community leaders go through major health episodes and not be able to get good health care treatment and coverage to take care of them, and had to do a launch, a launch good to try to raise money to take care of their health concerns. That's a problem. That we should be ashamed as a community to have our leaders experiencing that. So, and then, individually, as a society, this is problematic. So politically, we need to get on the ball and, we need to do something, these next legislative action seasons and do whatever we need to do to make that available. You want to say something about that? I knew that would be a cue in for you.
And actually, I'm going to start with the fact that imams don't have health coverage, because this might be a little bit controversial, but I think one of the challenges is our priority when it comes to fundraising. And I think sometimes we will fundraise for projects, for initiatives in other places. And we have people in other places that need help. So this is not a diss or a knock to any of those good works that are happening. But the reality is, if you're digging a well in a country that is halfway around the world, but your community leader has cancer and can't get oncology treatment and radiation, that's problematic for everybody. If you're creating masajid halfway around the world, but your community, doesn't have a social worker or a therapist to help people understand that hurting their parents when they have Alzheimer's and they're going through issues, that's the problem, right? We have elder abuse, but there's no one there to treat them because there's no funds to treat them. Because we've prioritized things in a way that says, if you can do a concrete, tangible structure, right, that is valued differently. And I work in, policy and politics, and so values are really important for guiding the work of allocating resources. And the reality is, everything that you put money towards is a statement of your values, right? And so if we're gonna say that I'm giving my money to this, we have to acknowledge we don't have unlimited amounts of money. So we're inherently saying this is more important than something else, whether we like it or not. That's the reality of it. So I think as we continue to give, we should be thoughtful and intentional about where we're giving and why we're giving. And it can't just be because it's a good work, because there are many good works. So we have to prioritize the good works and understand that sometimes a good work in your local community that is going to benefit you and your children and your neighbors' parents is worth the giving of $10,000, $15,000, $20,000 in the same way that building a well or a school or a masajid is. Because in the end, that asset, that resource, will be able to benefit many people, sort of, that you will touch and that you will see. Getting started,
As I said, I'm a prevention specialist, so this one is near and dear. The lack of focus on prevention, early intervention, and a holistic perspective. That side of this says an ounce of prevention is worth a pound of cure. It really is. We have trouble sometimes proving it, And so, from a, return on investment, type of, perspective. But the reality is, I've seen it time and time again. If we can get to people, before they are in dire straits, before they're in a critical situation, they're going to be much better for it. And if we can engage in some of the preventive health care or the early health care, mental health, physical health, emotional health care practices, and if we can integrate, somebody said to me the other day, why can't they treat me like a whole person? I gotta go to the podiatrist for that. And I gotta go to meet somebody else from the knee. I'm like, why can't they just treat me like a whole person? That's called integrative medicine, right? Is that what that's called? I don't know. But anyway, from my point of view, we should be integrating healthcare, and we're not doing it. We're not doing it. And so we need to do a better job of it. And so these are some of the obstacles to self-care and for each of us and for us as a society to engage in self-care. So, some self-care strategies and facilitators or facilitating factors might include learning to say no to good and great ideas. How many of you are okay, sure, I'll do it. Why not? No, you're not one. I'm not either. Yeah. Unfortunately, my children, my young people are here. They will tell you I take on way too much, and some of it's good, but a lot of it's not. We need to learn to say no and realize that somebody else can do that. And I've always said, well, if I don't do it, it ain't gonna get. So, I mean, maybe it's just not time yet. Maybe this isn't the time. Maybe we have to kind of get some more people involved so that they can do that part, and I can do something else. Okay. We need to guard quality time for ourselves and our family. In fact, that needs to be the first thing. How many of you? I know a lot of you are on. You have a digital calendar, you're using your phone calendar, that's okay. But whether you use a digital or paper, I'm old school, I use paper, you need to mark out family time. You need to mark out vacation time first. That's first step. And I have not been the greatest at that, but one of the things I am working on, in all transparency, is trying to do that first. My time and my family time first. And so that's one of the things that we need to do. And remember that we can't be all things to all people and to the community. Because the reality is when you're gone, the community's still going to be here. And we're all at different places regarding our spirituality. So, but this is important. This is an important part of who we are. So no matter what your faith is, and I think many of us are Muslims, but some of us may not be. You may have a different faith tradition, but in connecting with Allah is going to be such an important, it's going to be your salvation. It's going to be the thing that helps you get through. Verily, Allah says in Surah Inshara, verily so, in difficulty there is ease. Yeah. In difficulty there is ease, and that He will not put a burden on us greater than we can bear. And I don't know if any of you saw there was a speech given by Yasmin Mogahid, and she talked about Prophet Musa alayhi salam and how he was facing the Red Sea. And she was talking about it in relationships, so some of the folks that might have been at a mass conference or something might have heard this. But she was talking about how Musa alayhi salam was facing the Red Sea. And Pharaoh's army was behind him. And the Beni Israel, they were like, oh Lord, oh no, what you gonna do? And he was there, and he had his staff, and he said, and he knew that Allah had his back. And we're not gonna have to, we're not gonna have many Red Seas in front of us and staffs to strike, right? But he did. And so it's important for us to remember that Allah has our back. In the worst of times, Allah has our back. And sometimes it's hard to remember that. You know, when the going gets really tough, it's hard to remember it. It gets really painful sometimes. But the reality is that if we have been building our relationship with Allah and getting closer to Allah, when the stuff hits the fan and we take it back to Allah, it's going to be that much easier. And for those who don't have that connection, it is going to be difficult, but it's not impossible to get that connection and to come back. So, prayer, dhikr, reading and reflecting on Quran and what Allah says, those are the words of our Lord. And He has a message for, how many of you have opened the Quran and said, oh, that was for me? SubhanAllah, that was for me. Yeah. So, personal time, whether that's reading, taking a bath. I don't know when the last time I took a bath. Sorry, since I've had children, only do showers. No time for bath, Maybe one day as I'm getting older and now they're all grown up and having their own families, maybe I could do that, Taking care of your nails, your hair, spa, alone time. Some people say, oh, this is selfish. I don't have time for that. That's not, but that is putting your mask on. That's putting your mask on.
We need some for the fellas in there. That was
so. Tell me that. Okay. Well, let me finish this and you share those. Okay? I'll let you share. Couple time is. We're gonna let you add on, okay? Couple time is so important.
We're gonna put this slide together.
Date night is important, ladies and gentlemen. Okay, it's important to carve out that time. It may not be. You may have maybe once a week or twice, but you should have an expectation that you're gonna have some time together. Okay. Whatever your love languages are, however, that may be, but you got to carve out time for each other.
I just want to point out friend time for those of us that may be single.
Yes, absolutely. Friend time, spending time with your friends, so important. Vacation, walks, just whatever it is that you need to do to reinvigorate your relationships is what you need to do. Family time. I just suggested game night. My husband used to do Islamic moments. Like we just, after mix a lot, we just sit there and just, question, say some things with the kids or have discussions around. So there are different things that we can do. And just play. Play and laugh. The Prophet ﷺ, when his Sahaba asked him, they would say, when we're with you, we're so spiritually engaged. And when we leave you, we're like, are we doing the right thing? Because we like having fun. And he said, there's a time for this, and there's a time for that. So important. What are some great things and examples for guys?
I can't speak for all guys, but I'll say that I like to play sports. I like to go to the gym. I didn't see those on there. But those are just, two things that I think allow my sort of hormones and chemicals to move around and do whatever that they got to do to be able to make me feel right. I found that when I don't do those things, I'm a whole different person. And I actually, I don't think as sharp. I don't process as fast. I have less patience to deal with people. I feel tired, yet I'm still staying up late. Like there are a lot of imbalances with my sort of just humanity, my way of being, that I think we have to take note of and actually take care to address through things like moving our bodies. We weren't meant to just sit in chairs, all day long. We weren't meant to never sweat. We weren't, we go from sort of one climate-controlled environment to another, right? So it's our house, to the car, to the office, to the mall, back to the car, back to the house, to another place, and we never even feel like warmth. Some of y'all in Michigan might feel cold, or some of these northeast places, but
Phoenix and Arizona is a good thing that we don't.
I'm in California, and you can actually sort of not register what's going on with the world around you. And so I think that being able to be in touch with those things allow you to have a different a different approach and a different perspective to things that are happening with you, right? So you can feel like, oh, I don't feel right today. Like, what's happening? What's going on? And I can address that.
And actually, I think that's an important point because Allah has created signs for us. The signs, and our bodies provide signs for us. And so, thank you. And so, oftentimes we don't pay attention to the signs. You know, like sometimes if you're feeling like this past week I was saying I was feeling anxiety. I had a really heavy chest. You know, and I was like trying to get this heaviness off, but I was feeling it and I was aware of it, you know. What about, you know, when you're feeling anxiety and your stomach's making all kinds of things going on, you know, or your head is aching. We have to pay, those are signs. Don't ignore them. Those are signs for us. So self-care strategies also include, and we mentioned it, nutrition. The word on the street is that more organic, plant-based is better for us. Now, so a lot of us are real strong meat eaters, and I'm a meat eater to some degree. But from a health perspective, the word on the street is that eating more vegetables and fruit is better for us, okay? And organic based, or at least not with a whole lot of pesticides, okay? And what's that, Susan talked about that study, what's that study called? I can't remember. If it comes back to me, I'll tell you. Exercise at least 30 minutes most days. Okay, basketball, soccer, football, cardio, dance, Zumba, whatever it is that gets you moving. Stretching. Stretching is so important, and as I get older, I recognize you've got back problems and neck, yeah, I see a lot.